Hi, I'm Dr. Krayuth Zabarana. I'm a board-certified sleep specialist and a board-certified neurologist. I work at SciMed Health in the sleep and neurology divisions in Gainesville, Florida. Good sleep is very important. It's just as important as regular exercise and eating healthy. With good, effective, sufficient sleep, we feel well rested, we're less anxious, it helps our mood. It's also good for our cardiovascular health. When we're asleep, our blood pressure and our heart rates are lower. It puts less stress on our heart. Getting good, sufficient sleep is important for our overall well-being and general health. Conversely, not having enough sleep or having ineffective sleep adversely affects our health. And those of us who don't get enough sleep, whether it's due to insomnia or just not prioritizing our sleep, our health can suffer. In general, we'll feel less well rested in the morning. We won't feel as mentally sharp. We can have brain fog, especially in the mornings. Insufficient sleep also increases the risk for cardiovascular morbidities such as high blood pressure. Insufficient sleep also increases a hormone called ghrelin, and ghrelin stimulates our appetite. So in those of us who don't sleep enough, we're more prone to obesity. In those of us with insomnia, in those of us who have difficulty falling asleep or staying asleep, it would be especially important to observe good sleep hygiene. We want to reserve the bed for sleep or for romance because we want to associate the bed with sleep and not with other stimulating activities. So when we're in bed, we want to avoid watching TV, we want to avoid looking at our phones or surfing the internet. It's also important to keep the bedroom cool. 65 to 70 degrees is a good sleep temperature. Also with regards to good sleep hygiene, we want to avoid stimulating substances too close to bedtime. We want to avoid nicotine and caffeine within 3 hours of bedtime. Of course, in general, it's better to avoid nicotine. We also want to aim for regular exercise because that helps us sleep better at night. 30 minutes of regular exercise on a daily basis is a good goal to strive for. Preferably, it's best not to exercise too close to bedtime. So we want to exercise either in the mornings or the early afternoons. Well, if one has persistent sleep issues that last for more than 2 months, it will be important to talk to your doctor. For instance, if someone has chronic insomnia or obstructive sleep apnea, there are treatments that can be offered by your physician. They can refer you to a sleep specialist, perhaps refer you to a psychologist for insomnia, or some cognitive behavioral therapy that could help. In some cases, medications may be needed, hopefully only on a temporary basis to help with insomnia. And then, of course, with regards to obstructive sleep apnea, there are treatments such as CPAP, which can only be managed by your physician.